Autocratic moves. The Trump administration's gag order on the CDC and its implications. The role of the Centers for Disease Control and Prevention (CDC) has long been to provide the American public with transparent, science-based guidance on public health issues. However, during the Trump administration, concerns arose over increasing political interference in the agency's operations. One of the most alarming aspects of this interference was the apparent gag order placed on the CDC and other health agencies, restricting their ability to share scientific findings and recommendations independently. This move not only compromised the integrity of public health communication, but also demonstrated an autocratic tendency within the administration, prioritizing political narratives over factual information. The CDC's historical role and the Trump administration's interference. The CDC, founded in 1946, has traditionally functioned as an apolitical agency, offering evidence-based public health guidance to protect Americans from infectious diseases and health threats. Its work has been instrumental in controlling outbreaks such as polio, Ebola, and Zika. However, under the Trump administration, the agency found itself entangled in political disputes, particularly regarding the handling of the COVID-19 pandemic. Reports from various sources, including whistleblowers and investigative journalists, suggested that high-ranking officials in the Trump administration sought to control or alter the CDC's messaging. Public health reports were allegedly edited to downplay risks, scientific guidelines were revised to align with White House talking points, and health officials were pressured to avoid contradicting the administration's stance on issues like testing, mask mandates, and vaccine distribution. These interventions eroded public confidence in the CDC's recommendations at a time when reliable information was most needed. The COVID-19 pandemic, a case study in censorship. During the early months of the COVID-19 outbreak, the Trump administration frequently dismissed the severity of the virus, comparing it to the flu and opposing lockdown measures. Meanwhile, the CDC had the difficult task of warning the public about the real dangers of the pandemic. Reports emerged that CDC scientists were advised not to contradict the president's optimistic rhetoric and to limit direct communication with the media. One of the most striking examples of this censorship occurred in 2020, when CDC officials were reportedly barred from conducting briefings without White House approval. Dr. Nancy Messonnier, a CDC official, was among those sidelined after she issued a stark warning in February 2020, urging Americans to prepare for the virus's spread. Her statement contradicted Trump's claims that the virus was under control, leading to backlash from the administration. Additionally, the administration pushed for changes in the CDC's Morbidity and Mortality Weekly Reports, MMWR, a historically non-political scientific publication. Political appointees reportedly pressured CDC officials to revise or delay the release of data that conflicted with the administration's narrative. These efforts to manipulate information resulted in widespread confusion, misinformation, and a delay in the public adopting precautionary measures, ultimately contributing to the catastrophic toll of COVID-19 in the United States. The consequences of suppressing public health information. The suppression of scientific information by the Trump administration had profound consequences, including 1. Erosion of public trust. The CDC has historically been a trusted institution, but political interference undermined its credibility. Conflicting messages from scientists and politicians led to confusion and skepticism among the public. 2. Worsening the COVID-19 crisis. Delays in transparent communication contributed to slower public adoption of safety measures, potentially leading to higher infection and death rates. 3. Harm to government institutions. The weaponization of public health agencies for political gain sets a dangerous precedent, weakening their ability to function independently in future crises. 4. Increased spread of misinformation. When government officials suppressed scientific findings, it created space for misinformation and conspiracy theories to flourish, further hindering efforts to control the pandemic. The broader threat of autocratic governance. The Trump administration's efforts to muzzle scientific institutions reflect a broader pattern of autocratic governance, where political leaders attempt to control narratives by restricting dissenting voices. Similar tactics have been observed in authoritarian regimes worldwide, where state-controlled messaging replaces objective information to maintain political power. In democratic societies, such practices threaten fundamental principles like free speech, governmental transparency, and the public's right to factual information. Restricting agencies like the CDC from providing independent expertise is not just a short-term political maneuver. It can have long-lasting consequences for public health and democracy itself. Future administrations must work to rebuild trust in scientific institutions by ensuring they remain independent from political pressure. Conclusion: the Trump administration's interference with the CDC's ability to communicate freely during the COVID-19 pandemic serves as a stark warning about the dangers of political control over scientific institutions. In times of crisis, an informed public is essential for effective response efforts. Efforts to silence health experts in favor of political convenience can lead to unnecessary deaths, prolonged crises, and a weakened democracy. Safeguarding scientific independence should be a bipartisan priority to ensure that public health decisions are guided by facts, not political agendas.